Hi, welcome everyone. I am going live today with the founder of Femasys, Kathy Lee-Sepsick, who will be giving us a lot of invaluable information all around tubal blockage and how you can speak to your physician about looking into this. So here she is now. Have your questions ready today. Welcome to those who are joining. Nice to see you. Hello. Here we are. Hello, Kathy. Welcome.
Hello. Thank you so much for having me.
It's an absolute honor to be speaking with you today. I know that we have met multiple times at conferences in the fertility space around the world, and I'm so delighted that we're able to be bringing your expertise and discussions around tubal blockages to our readers today, and everything that you've done as the founder of Femasys, which is incredible. So please do introduce yourself to begin with.
So I am Kathy Lee-Sepsick. I am the founder, president, and CEO of Femasys. I started the company with the sole mission to advance women's health products in key critical areas that are devoid of innovation, and I'm thrilled to be speaking about one of the products today.
Great. And the product being FemVue.
Correct.
Absolutely. So if anyone has any questions whilst we're speaking, please do feel free to ask Kathy for her expertise. I would like to start by asking you, how do you define tubal factor infertility? And is it the same thing as having blocked fallopian tubes?
So it is, in fact, the same thing. And it is an issue that is often undiagnosed.
Yeah.
And I know we'll talk about, potential symptoms and associated issues. So it is a prevalent issue. Roughly 30% of women struggling with infertility may have one or both of her tubes blocked.
Okay. And people may not know that they do have blocked tubes, right?
Correct. Generally, they're asymptomatic.
Yeah.
They have no signal or sign that they're having that particular issue, as opposed to other potential infertility factors by which there are clear signs.
Mm-hmm. So, for example, people could be going to see a fertility specialist, jumping into IVF without having explored the option of their fallopian tubes where they could potentially be getting pregnant naturally.
And generally, if they're at an infertility specialist at that level of treatment and care, this, checking the fallopian tubes is a baseline
Yeah.
requirement. It's really outside of that infertility care. If they're at an OBGYN, are they having all of their factors evaluated as part of their treatment planning? Because it definitely changes the course of how you would approach your journey.
Absolutely.
If you don't have all the answers.
Would you say that it is common that people, especially in the States, when they're starting treatment, would have these tests done, or is it often later down the line that this might be something that's looked at?
I mean, one of the reasons I advanced FemVue was to change the point of care for this test. Prior to FemVue, a female could have all of her potential infertility factors evaluated by her GYN absent her tubes. So we're required a referral to a radiology center. It's costly. It's a separate visit. It also bears some risk because there's radiation exposure for this extra test. So for all those reasons, oftentimes women wouldn't get that test. And so they'd have part of the answers and they would potentially be prescribed medication or other things that maybe wouldn't be the right course had they known the answer. So FemVue changes that because we add on to the existing ultrasound exam so that all the factors can be evaluated in the same visit. This ultrasound is definitely more prevalent in your country where you are, in Europe, in Canada. I would say the US is unfortunately a bit behind, particularly from a GYN standpoint. But, in the discussion with FemVue, this helps, make a complete exam. So she has everything done in an affordable way at the same time.
And if anyone watching has had experience with, having blocked fallopian tubes diagnosed, or having this testing done, please do share your experience. A question for you: can someone have both tubes blocked at once? And what's the difference between proximal blockage and distal blockage of the fallopian tubes?
So a woman can have both tubes blocked, called bilateral blockage, but oftentimes she has one blockage. And for fertilization to occur, she only does need one operable tube. So she can still get pregnant naturally or even with enhanced treatment modalities with a single tube.
Mm-hmm.
Location of a blockage, proximal, distal, that's just where in the
Right.
tube that blockage exists.
Because we do see patients, of course, don't we, who may have had an ectopic pregnancy and have lost a tube. So then obviously there's a concern around, can they still conceive naturally with one tube or through IUI?
And sometimes the treatment plan is to remove a tube if
Right.
she has susceptibility to that, or to put something in the tube
Mm.
to prevent a pregnancy from occurring, on that side.
Yeah.
Um,
Could you
so
tell us?
FemVue is important. So that baseline diagnostic test is important so they know which tube is actually viable.
Absolutely. Absolutely. How does FemVue work as a product in a physician's office?
So ultrasound is the basis for the imaging.
Yep.
Uh, FemVue creates a natural saline and air contrast that allows the physician to evaluate the fallopian tubes. When they evaluate the uterus in contrast, they use just plain
Okay.
saline because and saline presents itself as black
Yeah.
under ultrasound. So they're able to see any issues in the uterine cavity because they put saline in, and that's standard of care. But you cannot see the tubes if you're filled with saline.
Mm-hmm.
So FemVue uniquely puts a train or bubbles in a consistent manner. It allows that train to go into the tube so we can evaluate whether or not she has an open tube or if in fact she's blocked. So it can be, like, again, added on to that existing exam where they look at the uterine cavity and then subsequently can look at the tubes.
Okay. Amazing. And do you find that lots of physicians are using the product? So is it something that's becoming more commonplace around the world?
So, we as a company, we're small and we're emerging, and we have dedicated most of our dollars up until recently to our clinical programs
Mm-hmm.
as we advance other products. So we are just at the impetus of formalizing a commercial team to allow for us to bring this product forward in a more significant way in the US, and we are partnering with others outside the US. We are undergoing the CE mark process for Europe, and we already
Yep.
have Canadian approval. And
Amazing.
we've been allowed, this is started as part of our process because of our Femasys product.
Mm-hmm. Mm-hmm.
Therapeutic option that requires at least one tube be open. As we take that next step in therapy, after FemVue for diagnosis occurs, we then have an option where women could have sperm placed directly in the open tube. So the two products
So
hand in hand.
absolutely. Could people who might be watching, who are potential patients or soon to be patients or current patients, could they take this to their physician, to their center, and say, this is something that I would like to try?
Yeah. And we're at the FemVue has been available in the U.S. market and in other select markets. So in these markets, yes, she can go to her practitioner and say,
Right.
I'm interested in having this type of exam instead of having a referral to a radiology center. We
Brilliant.
also have a practice locator on the website, so patients can put in their zip code and be presented with practicing locations where they could go for the exam.
And we have linked up your website in our bio, so please do check it out for anyone who is interested in finding out more, because it will obviously be of great support and help to so many people who are watching this. This is a question I've always wanted to know, like, would someone normally have any signs or symptoms that they may have a blocked fallopian tube?
Asymptomatic generally.
Right.
So no symptoms at all, which is the concerning part, because it could be the culprit and you just have no signs that it's occurring. And I think you're probably going to ask me, like, what other ailments, what could cause it? It could be pelvic inflammatory disease, sexually transmitted diseases like syphilis or gonorrhea, could be endometriosis, which be diagnosed with the cavity, but it could affect the tubes. It could be, like, as you mentioned earlier, that she had an ectopic pregnancy and that caused blockage in her tube, or she had some abdominal surgery that caused scarring. So there are other issues, but blocked tubes in and of itself don't generally cause any symptoms. The symptom is she isn't able to get pregnant.
Yeah. Yeah, absolutely. And say someone is using the product and that's identified as a problem, what would be the course of treatment?
It really depends on her situation. So that'd be something her dog, you should have to look at, the physician will have to look at the complete
Yeah.
story. Um, because in combination with something else, it may require a different treatment plan. It, if she only has one operable tube, it could be that she's a perfect Femasys candidate, and that intratubal insemination is the next
Hmm.
appropriate step for her. So all of those things would be on the table, but each individual is such an individual journey that there could be other factors involved. What I will mention, however, is if someone has mucus in their fallopian tube and they undergo this test, and it is a known potential benefit that FemVue, or even if she had the radiology exam, that high pressure of trying to evaluate that tube could move mucus out of the way. And
Right.
some have pregnancies
Wow.
as a result. It's been more of a flushing effect. So
Uh-huh.
that is, again, a known side effect and potential benefit. If it's a true blockage of ingrowth of scar tissue, that's a different treatment plan.
Hmm. Absolutely fascinating what you've created. I'd love to know a bit more about how you sort of got into this field and how where this originated from.
So I have a long history in med tech,
Yeah.
and I decided to start Femasys 20 years ago, and it was explicit, a very deliberate decision. I'm the lead inventor on all of the products, and I've looked to areas where it just, why are there not better options?
Hmm.
Why are we leaning on 100-year-old technologies and saying that that's
Yeah.
okay? And I get it. It's what the journey I've had for 20 years has been challenging from a fundraising standpoint and keeping the company afloat, when nobody really, they say they care about women's health, but stepping up and really doing something about it has been a void. And so these innovative products are so, so very important. And we find ourselves with no competitive threat.
Hmm.
We're addressing areas where there's big voids. So it's a mission of passion. I've been wanting to, I think you age, you always look, it's not just work, it's how do you leave something behind? And this is my leave behind, and I have a lot of work left to do to make sure that we get all of these types of products. They're all innovative, the ones that we're working on. And how do we move the needle for women? How do
Hmm.
we just make sense of the options that they have laid out in front of them so that we have better care and we can address these major issues in the market? So
Absolutely.
that's why.
Absolutely amazing. And I also wanted to ask you, for people who are reading, watching, finding out more about this incredible option that you're giving people, at what stage in your fertility journey should people be exploring tubal factor as a potential cause of not getting pregnant?
Very beginning.
Right.
It
Okay.
is a baseline diagnostic test. So if you're approached by your physician and they're not checking all your factors, it's up to you. Women are empowered. Ask, you want a complete view of what your issues may or may not be. Check the boxes, and make sure that all of those factors are being considered before a treatment plan is laid out for you. So, empower yourself, learn. There's lots of resources out there, but tubes are a critical part. I mean, conception happens in the tube.
Yeah.
So if you have a blocked tubes, it's never going to happen unless you come up with the treatment plan. So the blocked tube issue, and most of the time it's a unilateral blockage, a single tube that's blocked. So the options are not, you know, cut off. It's just a different way to
Hmm.
approach the next part of the journey. I've also seen patients that are advancing in their years and want to just know that all the reproductive organs are
Yeah.
working the way that they should be. So
Yeah.
I've seen patients go in and say, I just want to know that I could get pregnant. And that could be an appropriate test for that person as well.
Absolutely. Absolutely. Really good point. And also, like we touched on before, and I know we've talked about this when we've met in person, if people can avoid going down the full treatment route of needing IVF, for example, without needing it, if it can be resolved through, tube blockage, for example, obviously that means that people don't necessarily need to spend the money, the time, put their body through the injections, the medication, etc., to go through the IVF process.
Agreed. I mean, I think you always want to address the problem with the least risky, least costly, least invasive way first. And time is always of the essence. We know this, as you and I have intimately spoken to women on, that are going through their own personal
Yeah.
journeys. So yes, but don't skip steps,
Yeah.
because it's important to make sure that you do these exams and know what your actual situation is, to make sure that the proper treatment plans are laid out and for you to make the best choices for yourself.
Do you think that this would be a good thing for people to speak to their physicians about if they're about to do IUI, for example, as well?
100%. Again, you cannot get pregnant. IUI deposits sperm into the uterine cavity. If the tube is blocked, it's not going to work.
Mm-hmm.
And we with Femiseed have the next approach beyond a standard IUI, right? When we put sperm directly into the fallopian tube, and in that case, we need to know which tube. If she only
Yeah.
has one operable tube, where do we put it? And further to that, if she's ovulating, which side is she ovulating on? Stack the odds in your favor. The
Mm-hmm.
journey is very clear from a biology standpoint. The sperm needs to make it into the tube to conceive. So
100%.
how do we ensure that that happens? The tube is an integral part of the whole solution.
Yeah. And you don't want to waste the sperm as well.
Agreed.
That is really interesting to know. If anyone has any questions for Kathy, please do feel free to ask. What is the current standard for diagnosing blocked tubes in the US? You've touched on it, but tell us a bit more about the current approach. And you mentioned the sort of need to change and how maybe we're a little bit more advanced in the UK and Europe, but tell us a bit more about that.
So I guess what would be considered the standard of care as it stands is an X-ray exam called
Mm-hmm.
a microscopic hysterosalpingogram, or an
Yeah.
HSG. Again, this requires a referral to a radiology center. It's a radiologist that generally performs it. It exposes the patient to radiation, and they have to use radiopaque or X-ray dye, which is
Mm-hmm.
sticky, also very viscous or thick in its administration. Those are some of the clear advantages of FemVue when we use a natural contrast.
Mm-hmm.
We're using natural saline and air, so it's not sticky. It can travel through the tubes, easily, and it utilizes ultrasound. And importantly, she stays with their same practitioner, because every OBGYN, every infertility specialist, ultrasound is core for their practice. They have to have ultrasound
Yeah.
if they're doing any type of GYN
Mm-hmm.
procedures or obstetric. So all of that allows them to use their existing equipment and move that test. But that's the current test. And fluoroscopy is used for the heart. It's used for other areas of the body, but it's only used in that way to look at the tubes, because standard of care is using ultrasound and saline and evaluating the cavity. So the tube is that part that they just can't do without FemVue.
And how long would the procedure typically will the testing
So
take?
it depends on if it's an add-on. Let's say they're doing, because when they do ultrasound, they can look at her
Yeah.
ovaries. They can obviously evaluate other things. The exam runs about 10 minutes,
Okay.
from start to finish.
Yeah.
So they can do uterine cavity evaluation, and then replace the syringe with FemVue, deliver the bubbles, and then look at the tubes, and it's done.
And so,
So it's a quick exam.
so will it show the physician if there's a problem or not straight away?
Straight
Right.
away. And we've had patients, study the websites and know what it looks like because they can see the ultrasound
Wow.
images. Um,
Wow.
and they're like, whoa, look at that. So, they can, sometimes we have to, the physician has to work for it a little bit. They might have free flow on one tube and have to really assess the other tube. And that's all part of the course of the procedure. And pretty fast.
Yeah. Okay, that's good to know. And we've talked a bit about other testing available and why people should ask their physician about Femasys and the FemVue product. Is there anything else that you think people should know about reasons why it's worth mentioning to your physician? Ease of use, what it might show up, everything you've sort of just uncovered, I guess, really.
Well, in summary, I think it's about completeness.
Yeah.
So if you're undergoing an exam for your other potential factors, it's better for you as a patient to have it done at the same time.
Mhm.
Okay. If you're having to have your tubes reevaluated, so be it. But if you're at the beginning of your journey, it's a major critical factor that should be evaluated, and you shouldn't have to go to a second
Mhm.
place. It's more expensive. It's a foreign doctor. It's a referral. They have to insert a catheter again. All those things that if you just do it at the same time, is beneficial for the patient. So
Mhm.
cost, affordability, convenience, quick for treatment planning, know the results and come up with a treatment plan faster.
Mhm.
When you go to a radiologist, you have to wait for the report. You have to
Yes.
check in by N again. There's all these time elements and extra inconvenience and aggravation and all those things. And again, crossing your cervix and putting another product into your body, once you've already had another exam, it's two separate exams as opposed to an add-on to an
Mhm.
existing exam. So those
Mhm.
are all, really important reasons to at least explore it as an option. And it may be that because the company is small, because we haven't had a sales force, that the doctor doesn't know.
Mhm.
They're able to train online. It's that simple of a procedure, and we can, attend to them and be able to get them to be effective and be able to offer it to their patients very quickly.
Mhm. If it was me and I was having this checked, I would probably, and was potentially struggling with unexplained infertility, I guess there might be a sense of relief that comes with it, knowing that an issue has been identified so that you can work on a plan to, you know, so get it sorted or move on to your next stage or whatever it might be to sort of move along with the process of trying to conceive.
I think there's also relief in knowing when there's not an issue.
Yes, of
You
course,
know,
yeah.
so checking the boxes is just an important part of the initial part of the journey. Just
Yeah.
knowing that things are functioning the way that they need to. And again, things can change over time. If you're in the journey for a long time, or even secondary
I was
infertility,
gonna
where
say,
people are often surprised, and it happens. We have lots of patients that have secondary infertility where they were conceived once before. They don't understand. Well, things change over time. So it's really important to check the basic
mhm,
factors, in addition to the male sperm count, right?
mhm.
So the male's part of this equation too. But all of those factors for the female, this is part of her baseline diagnostic test, and it should not be remiss. We should insist.
I think secondary infertility is a really good point because it's very easy just to assume that because it happened before, there should, it should be fine to happen again. But as you said, things can change, especially, over time or whatever the circumstance might be. So I guess it's about covering your bases, as you said, getting checks done earlier or sooner rather than later, and make sure that no steps are being skipped so that you're following the right protocol to get you to where you want to be.
Exactly. Could not have said it better.
Well, thank you so much, Kathy. Is there anything that you want to leave us with today when people go to our link in bio and check out more about Femasys and the product FemVue, and potentially bring up this conversation with their fertility specialist?
No, I mean, we as a company, our mission has been the same for 20 years. We're looking to help women bring options, accessibility, and it's really about you empowering yourself in
Absolutely.
your personal journey and making sure, we are doing, we're trying to offer these solutions, but it's really about, what's best for you and, looking at things that are safer, less expensive, convenient, reliable, all those things that are important. These are the things that should weigh into the decision making. And, if there's questions, send them along our way. And we have other products to come. So, we're appreciative of the support as a company, as we continue as a small company trying to, make a big difference in women's health. So appreciate the time and the interest.
Absolutely. And it's so nice to be speaking to someone who has the same goals of empowering people, women, to help with, getting you to where you want to be in women's health, for example.
Absolutely.
All right. Well,
Thanks
thank you so much for your time, Kathy. Thanks to those who've joined and watching back. And please do check out our link in bio to find out more about testing for blocked tubes and the product FemVue to help you with a solution for this. Thank you very
Thank you.
much. Thanks. Bye.
Bye.